Have you ever felt unusually tired, short of breath, or noticed discomfort in your chest without a clear reason? These subtle changes could be signs that your heart is under stress. Sometimes, the early warning signs of heart strain are easy to overlook or dismiss as nothing serious. However, paying attention to these small signals is crucial for your health. Your heart is working non-stop to keep you alive, and if it starts to struggle, it's important to notice the signs before things get worse. In this video, we'll discuss 9 common but often overlooked signs that your heart might need some extra attention. By recognizing these symptoms early, you can take proactive steps to protect your heart and overall well-being. Let's get started. 1. Unusual shortness of breath. Have you been feeling out of breath more easily lately? Shortness of breath can be one of the first signs that your heart is under stress. If climbing a flight of stairs or doing everyday tasks like walking feels more difficult than it used to, your heart could be struggling to pump oxygen-rich blood effectively. This might happen suddenly or gradually, and it's important to listen to your body. Over time, your heart may not be able to keep up with the demand for oxygen, which leads to that feeling of breathlessness. If this feeling persists or gets worse, it's a red flag that needs your attention. Shortness of breath can also come with a tightness in the chest or difficulty recovering after minimal exertion. If this sounds familiar, don't ignore it. It's important to speak with a healthcare professional to understand the cause. Sometimes, heart problems like congestive heart failure can manifest this way, so getting checked out is the best way to stay ahead of potential complications. 2. Persistent fatigue. We all feel tired from time to time, but if you're noticing extreme fatigue that doesn't improve with rest, it could be linked to heart strain. Heart-related fatigue is often more profound than regular tiredness, and it might make everyday activities like showering, walking, or even light housework feel exhausting. When your heart isn't pumping blood efficiently, your body doesn't get the oxygen and nutrients it needs, leading to that deep, constant tiredness. This type of fatigue can happen even when you're getting enough sleep. It's important to notice if you're finding it hard to keep up with your usual routine or if your energy just doesn't seem to bounce back. If these feelings persist, it's time to explore whether your heart is working harder than it should. It could be an early indicator that your heart needs a little extra support to function properly. 3. Chest discomfort or pressure. Chest pain can range from mild to severe, and it's not always the dramatic, sharp pain people associate with heart attacks. Sometimes, chest discomfort feels like tightness, heaviness, or even a subtle fullness in the center of the chest. These sensations can happen with stress, after meals, or during physical activity. While occasional chest discomfort might be due to indigestion or muscle strain, frequent or persistent discomfort warrants attention, especially if it comes with other symptoms. If the pain radiates to other areas like the arm, neck, jaw, or back, or if it's accompanied by sweating, nausea, or shortness of breath, these are serious symptoms that should never be ignored. Early detection can prevent heart attacks or other severe cardiac events, so don't wait too long to get checked out. Understanding these signals early can save lives. 4. Swelling in the legs, ankles, or feet. Swelling in your lower body, especially the legs, ankles, or feet, can be a sign that your heart is struggling to pump blood effectively. When the heart can't keep up with the demand, fluid can build up in the lower extremities due to gravity. You may notice that your shoes fit tighter or that your socks leave marks on your legs by the end of the day. Swelling can be accompanied by weight gain, difficulty breathing, or even fatigue, signaling that your heart may not be functioning properly. This condition, known as edema, can be a symptom of heart failure, where the heart isn't pumping blood efficiently. If you experience swelling along with any of these other symptoms, it's important to speak with your doctor for further evaluation. Early detection and intervention can help manage heart strain and prevent it from getting worse. 5. Irregular heartbeats, palpitations. Feeling your heart flutter, race, or beat irregularly can be a sign that your heart is under stress. These palpitations can feel like your heart is skipping a beat or even flipping in your chest. While palpitations are sometimes harmless and can be caused by caffeine or stress, frequent or intense palpitations might be a warning sign of an arrhythmia, which is an abnormal heart rhythm. If your heart is racing or you feel lightheaded or dizzy during palpitations, it's a good idea to get it checked out. arrhythmias can disrupt the heart's normal function, leading to more serious complications if left untreated. So, if you're noticing palpitations along with other symptoms like dizziness or chest discomfort, don't hesitate to schedule a visit to your doctor. 6. Dizziness or lightheadedness. If you find yourself feeling dizzy or lightheaded, especially during physical activity or when standing up, your heart might not be supplying enough blood to your brain. Dizziness can be a sign of low blood pressure, heart rhythm problems, or even heart failure, which can reduce blood flow. When your heart isn't working as it should, it struggles to circulate blood throughout the body, leading to feelings of unsteadiness or faintness. If you experience dizziness along with other symptoms like chest pain, palpitations, or shortness of breath, it's important to seek medical attention. This could be a sign that your heart is under strain and not able to keep up with the body's demands. A quick checkup can help rule out any serious issues and prevent complications. 7. Unexplained weight gain. Sudden or unexplained weight gain, especially if you notice 2 to 5 pounds gained within a few days, could signal that your heart isn't pumping blood efficiently, and fluid is being retained in your body. This fluid retention often happens in the legs, abdomen, or even the face. Weight gain from fluid retention is different from regular weight gain and is often accompanied by other symptoms like swelling, shortness of breath, or waking up at night feeling breathless. If you're experiencing this type of weight gain, it's essential to track it and speak with your doctor. Fluid retention due to heart strain could indicate early signs of heart failure, which requires immediate medical attention. Monitoring your weight regularly can help catch this early, allowing you to take steps to protect your heart health. 8. Difficulty sleeping flat. Do you find yourself needing extra pillows to sleep comfortably or waking up gasping for air? This condition, called orthopnea, occurs when fluid backs up into the lungs due to heart strain. It's especially noticeable when lying flat because the fluid redistributes within your body, making it harder to breathe. If you're having trouble breathing when you sleep or need to prop yourself up with extra pillows, it could be a sign that your heart is under strain and fluid is accumulating in your lungs. Orthopnea is a more serious sign of heart stress and should not be ignored. If you notice this symptom, it's important to talk to your healthcare provider for further evaluation. Getting the right treatment early can help prevent more severe heart issues down the line. 9. Frequent coughing or wheezing. A persistent cough, especially one that worsens when lying down, can sometimes indicate that your heart is under stress, rather than a simple lung issue. When the heart is struggling to pump blood efficiently, fluid can back up into the lungs, leading to coughing, wheezing, or tightness in the chest. If you're coughing without any signs of a cold, allergies, or infection, it's time to pay attention. This type of cough can also be accompanied by shortness of breath or a feeling of tightness in the chest. If you experience these symptoms frequently, it's a good idea to check in with your cardiology team for further evaluation. A simple checkup can help determine if your heart is the source of the problem and allow for timely intervention. There you have it, 9 signs that your heart might be under stress. Keep an eye on these subtle clues and take action if needed to protect your heart health. Remember, it's important to listen to your body and consult a healthcare professional if you notice any of these symptoms. Taking care of your heart today will benefit your overall well-being tomorrow. Stay proactive, stay healthy, and don't forget to like, share, and subscribe for more valuable insights on heart health and wellness. Thank you for watching, and take good care of your heart.